Right at the start of this, I'm going to answer one objection. People always say, look, this platform belongs to Zuckerberg. He can do whatever he wants with the platform. However, I would say that if you lived in a town and your mayor decided to change the laws in order to say that in this town, it is okay for me to hunt the citizens at will, can use arrows, can use traps, whatever I want, that is the new terms of service for this town or city which you happen to live in. If that happened to happen, you could argue that this is inconsistent with the public good. You could argue that this is inconsistent with the law of the land, and therefore that those laws are invalid. I'm gathering together evidence for a criminal negligence lawsuit against Facebook. This lawsuit has a few categories of evidence and has two categories of allegations. First of all, the context. The context is that many people are complacent towards the potential threat posed by COVID-19, and they often present this complacency to other people on Facebook in a context of presenting information which is inconsistent or antagonistic to information that has been presented by the WHO and the CDC. Point two, Facebook has been blocking me and blocking others as well from presenting information which is consistent with the views of the WHO and the information released by the CDC. For example, during the period of my ban, someone posted an article from CNBC noting that the WHO had revised the fatality rate of the coronavirus up to 3.4%. They posted this information and someone responded by saying, LOL, people live their lives in fear, give me a break, the flu causes more death. Now this person was mocking the information presented by the WHO. I, as a concerned citizen, consider that I should have the right to present information which is consistent with the WHO, or I should have the opportunity to correct this perspective which has been presented on the platform Facebook. This complacency in society is resulting in more people in our society being infected. The more people in my community who are infected and who are passing on this virus to other people, this endangers my life, the life of my friends, and for myself, most importantly, the life of my 21-year-old daughter who has autoimmune issues. These autoimmune issues have resulted in type 1 diabetes, a variety of other medical conditions, and have made her very susceptible to catching viruses and to the degree to which viruses impact her. On March the 3rd, an article in the Globe and Mail discussed the censorship in China, which has been done by the Communist Party. Basically, they discussed research into the social platform WeChat, where they can see that the Communist Party censored a lot of information. The research indicated that this posed a public health threat because less people were able to become aware, because less people had access to information regarding the actual health concerns associated with this virus. I'm personally not an advocate of censorship, but I would assert that if Facebook does censor people from presenting their own perspectives or their own views, they should be censoring the people who are presenting information which is inconsistent with the WHO and the CDC. They should not be blocking me from presenting information which is consistent with the WHO and the CDC. For example, during the period of my ban, I was blocked from presenting an article from CNBC, which presented information from the WHO. I was blocked from presenting a direct link to an article from the CDC, and of course, blocked from making arguments which I would assert seem to be completely consistent with the CDC. Point 5, if this attitude of complacency results in people from my community acquiring this infection, this censorship by Facebook, this deliberately blocking information, is a type of criminal negligence which is resulting in direct harm in our society. This can be argued in other ways. For example, I consider it a type of discrimination. There are people on Facebook who are promoting complacency, and then there are people on Facebook who are promoting health awareness and safety and good practices in order to resist the spread of this disease. By banning me, Facebook has banned someone who is trying to promote health awareness, who is trying to discuss these issues, and who is trying to encourage people to embrace practices which will reduce the spread of this disease, and of course other viruses as well, such as the regular flu and so forth. Now I also have to live in fear of being banned again and restricted from doing what I can to protect my family and friends. One of the times I was banned was merely for posting a link to an article from the Newsweek, which discussed the preparations which were being made by the Department of Justice. Now, knowing that Facebook can ban me that easily, and for that, for lack of a better word, pathetic of a reason, makes me be very careful with regards to what I have to present. That caution, I would say, is an inhibition from me actually being able to discuss and dialogue with others regarding the safety risks. Personally, I believe that people should be allowed to question the WHO and the CDC. I believe in free speech. I believe that dialogue is a healthy way that we can learn, interact with each other, possibly discover flaws in our thinking. I think that that is healthy for society. Personally, I'm not advocating for that. My lawsuit is not about that at all. I would actually say that if Facebook does decide to remove particular posts that I would make and say, well, this is inconsistent with the WHO, or this is consistent with the CDC, or you're not allowed to argue against this particular government policy, that's not what I'm discussing here. That's a separate issue altogether. For example, one of my bans was because I presented a clip from the movie Contagion where the people discussed wanting to restrict media attention on the pandemic for political reasons, for economic reasons, and so on. So basically, this is in the context of discussing why governments might want to downplay the extent of what is occurring. If Facebook wants to ban that kind of a discussion, that's not what this lawsuit is about. That is an issue, that's something we should be thinking about, but that's not what this lawsuit is discussing. This lawsuit is arguing that me being blocked from presenting information which is consistent with the WHO and CDC definitely has to be considered a type of negligence, is definitely harmful to society. Personally, it seems to me that there are a variety of people today that view themselves as the Moses of the 22nd century. Mark Zuckerberg has a lot of power. He's come down from Mount Sinai. He has his books of the law, and he's ready to throw it at people who make any statement that he doesn't appreciate. However, I would say that when Mark Zuckerberg does things which inhibit the health and safety of our communities, that it is him who is guilty of violating the law in a significant fashion.